initial response is similar to patients, which include extreme distress and disruption, a sense of vulnerability, awareness, an ability to protect the ones they love, and lead to intense helplessness. And because family members and patients often share common beliefs, common reaction to of family members may parallel those of patients. Denial and blaming others for the cancer caused by close family members. And of course, family members will experience vulnerability and realization that this could happen to them. So, as far as family is concerned, there are a lot of things that are going to worth looking at. The fact that there will be that sense of loss, that they'll be grieving the loss of the loved one, and yet the loved one is just there. This is why we talk about, I believe we talk about that as part of the Kubler loss or Ross loss and grief model. So they'll tend to blame those living about around the community, and there'll be a lot of disruption, sense of awareness, vulnerability, and there'll be no awareness to protect the loved one, and the fact that cancer patients make cancer makes one feel helpless that there's no hope, but there is a second chance for them to live. So maybe if I go back, the world will people will they this individual see things differently, and will see that the world has changed for him or for her. And of course, there isn't any much preparation going on, especially with the oncology department. You'll find that we are really good in taking care of our patients physically, but psychologically we don't tend to. When you look at the fact, this domain we are concentrating a lot on the family, and of course there's a diagram here. Um, there's the support group, there's the normal adjustment reaction, adjustment disorder, and of course subclinical symptoms to severe disease, and then there's the severe emotional and mental health disorders. There's the psychosocial well-being care and support during the cancer treatment. So I'll make a link, and this note will be available to you at the description. So there's the surgery, there's the treatment that creates its own psychosocial impact. Surgery is just one of the things people are afraid of, and such as mastect, mastectomies, mastectomies, genital surgeries, head surgeries, colostomies, generally associated with distress because of the changes of body function. So a colostomy bag is an incision that is made, and then they fit in a colostomy bag, and they'll get to to through the colostomy bag you'll get all the discharge coming from you will go through that bag. And of course there's a lot of stigma going around, but we'll explain our and for the individual who receives news about cancer diagnosis post-operatively, pain and weakness from the surgery will add the distress, depression created by the new diagnosis. So once they are not prepared to face what is going on, there'll be a lot of depression. I mean, they've lost an organ. That is a loss to this person, and that person will need a lot of support. And of course, chemotherapy, um, if there changes, mm, person might lose a lot of hair, vomiting every night, then the nausea tends to be a major concern about patients, and even education about the medication available to control these symptoms can address this concern. The hair loss is an emotional impact and the constant remainder of the diagnosis. So, forcing the patients to immediately integrate the diagnosis into their lives, so they get so things will change for them, and won't and they'll never be the same again. Every time they'll have to go for treatment and get to know what is there for them. And therefore forcing patients to meet. And of course, the visible reminder of the world is that the person has cancer, needing the opportunity to keep the diagnosis private. So very many people prefer to keep cancer private, and um, they're not willing to share. So fatigue and risk infection contribute to psychosocial dis. Chemotherapy forces patients to and family to adhere to medical appointment, hospitalizations, and relocate family roles, so that the patient usually cannot meet obligations because of the fatigue and other side effects. Um, Not being able to do daily activities such as going to work, completing household tasks, and even attending social events can also bring an impact of the cancer's mental health, of the cancer patient's mental health. So the way patients were doing things in the past is not like the way they are going to do now, because of uh, the cancer. It has really taken over their own lives. And of course, radiation therapy, um, radiation itself, people are taught to fear and avoid radiation, but radiation burns cancer, and it creates anxiety related to the cancer treatment. And even meeting new physician, a new team in the radiation department, lying alone in the tube with the machine overhead creates a sense of isolation and anxiety. Fears of about being burned and having visible skin tattoos may contribute to one's distress and create self-consciousness.